If your periods sometime arrive on time and other time disappear for months, or if you experience very heavy bleeding one cycle and almost none the next, I want to make one thing very clear as a pharmacist. This is not just a period problem. It can be a serious warning signal from your hormone, and if you are using Primolut N on your own or based on advice from friends or internet, this video is extremely important for you. Incorrect or unsupervised use of hormonal medicine such as Primolut N may give you temporarily relief, but it can create much bigger health problem in the long term. Menstruation is not a random process. It is a highly precise, hardly coordinated hormone cycle involving the brain, ovaries and uterus working in a precise balance. Hormones like estrogen and progesterone must rise and fall all the time, and when the balance is disturbed, the first system is to be affected is the menstruation cycle. Medically speaking, a cycle shorter than 21 days or longer than 35 days, frequently missed period, or unusual or heavy or light bleeding is classified as irregular menstruation. Common underlying cause including PCOS, thyroid issues, thyroid disorders, chronic stress, obesity, sudden weight loss, or misuse of hormonal medicine. Many women assume that the delay periods are harmless, but repeatedly irregular cycle should never be ignored. Over time, it can increase the risk of infertility, anemia, hormonal cyst, abnormal thickening of the uterine lining, or more or complex endocrine disorder. This is why proper evolution is essential instead of relying on a quick fix. When you talk about Primolut N, it is important to understand what is actual and what it is not. Primolut N contains a synthetic progesterone. Progesterone is a hormone naturally produced in the second half of the menstruation cycle to stabilize the lining of the uterine. When progesterone level is low, periods may be delayed or spotting may occur frequently. In such case, Primolut N temporarily supports the uterine lining and mimic the progesterone phase in the cycle. However, very important point may be misunderstand that Primolut N does not create the period. The bleeding occur after the medicine is when you after stop the medicine. Once Primolut N withdrawn, progesterone level suddenly falls. It is called the withdrawal bleeding, which appear like a normal period. Typically, Primolut N is prescribed 5 to 10 days and bleeding occurs within 2 to 7 days after stopping the medicine. If no bleeding occur after 10 days, it is indicated that underlying hormonal disorder or pregnancy or require further medical evaluation. Because Primolut N is a hormonal medicine, it can cause side effects. It may include headache, breast tenderness, mood changes, fluid retention. Most of the effects are mild and temporarily, but warning symptoms such as severe headache, visual disturbance, leg pain or swelling should never be ignored. In such case, the medicine should be stopped immediately and medical advice must be sought. As a pharmacist, I must emphasize that the Primolut N is not safe for everyone. It should not be used if there is a possibility of pregnancy, history of breast cancer, liver disease, clotting disorders, or unexpected or vaginal bleeding. Using Primolut N without the proper investigation such as ultrasound, hormonal test, and complete medical history can be a risky decision. Another critical point is that Primolut N is not a permanent solution. It is a temporary solution, so you must go to the permanent solution. Thank you.